All right, I think we can go ahead and get started. Thank you everybody for joining us today for this lunch Q&A with DaVita Medical Group. And we're gonna basically be talking about their journey with Anaplan and how they've leveraged the tool during these uncertain times. Our speaker today is Sean O'Connor with DaVita Medical Group. Sean, do you want to give us a quick introduction?
Yeah, hi everybody. My name is Sean O'Connor. I am with Legacy DaVita Medical Group, which has fairly recently been acquired by Optum. I am a manager of the finance innovation team, so our core responsibilities are really the maintenance, enhancements, build of any financial systems, and the automation of data to and from those reporting platforms. And the main reporting platform that we utilize today is Anaplan.
Excellent. And I'm going to be the moderator today. I'll be asking Sean some of these questions, and as we go through this session, if anybody has any questions, please feel free to submit them, and we'll get to them as we can. My name is Karthik. I'm a junior partner at Spalding Ridge, in charge of our healthcare and life sciences vertical. And Spalding Ridge is an advisory and technology implementation firm focused on bringing best-in-cloud solutions to our clients. So without further ado, we'll jump right into it. So Sean, we're here today to talk about y'all's journey with Anaplan. So let's start off by talking about how are y'all using Anaplan today? What catalyzed this journey with Anaplan?
Yeah, so the real catalyst behind utilizing Anaplan as a kind of a solution to our issues of reporting and forecasting, but budgeting, really began way back when our previous CFO, and he's now the market president of Washington, determined that we really needed a business-owned platform that we could all utilize and would help consolidate the reporting that was coming in across siloed markets. So everybody kind of had different P&Ls based on the mix of their business, be it more fee-for-service or more risk-based, and that just meant that a lot of the data that we were getting was not consistent on a monthly or quarterly format. So there was a ton of aggregation. It was taking a bunch of time for the FP&A teams to really aggregate the data, make sure that it was apples to apples with kind of the other markets, and then report upwards. So instead of doing really a lot of the analysis that they should have been doing, it was more of an aggregation exercise. So Jason stepped in and said, okay, we need a business-owned platform that we can really own, maintain, and will help us give capacity back to the FP&A team so that they can do their real jobs, which is really analyzing the data that they're getting and making informed decisions based off of that.
Got it. And when you say everybody, I guess, can you give us a little bit of a rundown of what the organization looked like at the time that you implemented Anaplan?
Yeah, absolutely. So there were, I believe, at the time, 6 pretty much siloed markets. So there was California, New Mexico, Colorado. At the time, there was also Arizona, Washington, and Florida. And each of those markets all, again, had different mixes of businesses, and they were all doing Excel-based reporting. And they all kind of looked at their P&Ls a little bit differently, obviously fairly similarly, but just even the slightest nuances can throw things off. So it was a lot of Excel reporting that really made for difficult aggregation processes, and just a ton of time spent doing consolidations versus the analysis of the actual data that they were getting.
Got it. So how much time would you say that y'all were spending doing that data aggregation and those kinds of activities?
Yeah, that was a very, very, very significant portion of our jobs. So before the implementation of Anaplan, I would say at least 75% of our time was spent purely consolidating, aggregating, making sure that the workbooks that we'd been using in the past were updated for somebody adding a line or something like that. So a ton of the time was spent really aggregating and consolidating the data and making sure that it was apples to what it needed to be. versus doing the actual analysis.
Got it. And how much time would you say you freed up for analysis today?
Probably 90+%, especially on the legacy DaVita Medical Group side. We've automated almost every single process. So we've utilized Anaplan along with a third-party ETL tool called SnapLogic, so that we can actually pull actuals directly from our GL or our ERP system, so SL Dynamics or Dynamics SL, excuse me. Push and pull that data directly to and from that system via SnapLogic, and then report in Anaplan. So people are not having to go out and get reports from the market-based finance teams to aggregate, consolidate, and report upwards. They're purely consuming the data that's now automated into Anaplan. So they have probably 90 to 95% of their capacity back.
Nice, very nice. And who's interacting with the tool? How many users do you have within the system today?
So today we have about 515 users interacting with the system, and that's ballpark, just given turnover and stuff like that. But around 515, ranging from SAs, so site admins, all the way up to executive leadership. It really is a tool that we've built out for everybody to utilize.
And how is how are your providers and end users interacting with the tool? Were they a part of the process before?
So before, they were not in any way a part of the process. If you were to ask a provider to get into the system, or get into a system, it was kind of like pulling teeth. It was never going to happen. So during the initial implementation, we recognized that was kind of a pain point, and we wanted to make sure that we were focused on building out a product that people would be either excited to get in or at least comfortable getting in and entering data, so that, or even just consuming data, so that they were comfortable looking at their financials and they were aware of things. There was full transparency. So we really have gotten a ton of buy-in from our clinical staff, from providers that are actually getting into the system, entering information for budgets, and then consuming the data to see where they are at from a financial standpoint, so that they're better understanding their P&Ls and they're a little bit more informed when they're having those monthly or quarterly discussions with the community finance directors or community finance.
Got it. So it kind of helps facilitate those conversations and demystify finance.
Absolutely, yeah. It made financials a less daunting thing for them. It really made it a little bit simpler, and was something that they could do anywhere because it's cloud-based. They can just log in and look at things and consume it on their own time because it's available 24/7. They don't have to go out and ask the community finance directors for a P&L or anything like that. They just log into the system and look at their own information and educate themselves, which I think a lot of them really cared for, because it was really self-help. So
yeah, no, I think that makes sense. And so during your first implementation, this was juggling 6 or 7 different markets, right, and tackling their needs. Recently, I mean, you just mentioned it, right? I think it was almost a year ago, y'all were acquired by Optum Health, right? And so how has that process been? What's that process been like? And how has Anaplan helped?
Knock on wood, the process has actually been pretty smooth so far. We're doing a phased approach in terms of transitioning from legacy DMG's GL to Optum's GL, which they utilize PeopleSoft, versus us utilizing Dynamics SL. And so, the corporate or national side of things was the first to go, and there was a bunch of time spent up front making sure that our GL string, so our cost centers, tentative sub-accounts, site and department, mapped one-to-one to a GL string on the Optum side of things, so department and location combinations, so that there was kind of either a one-to-one mapping or the roll-ups were synonymous. So we spent a lot of time really figuring out all of the mapping, and then once we got that, it was honestly a matter of replicating a model and building out the new hierarchies in the PeopleSoft sense, and then replicating everything that had already been done. So it really made things very, very simplistic from a transition standpoint. There was honestly no hiccup. People were able to one day go into the old finance model, national finance model, and then the next day they were actually able to transition to the new one, and it was honestly a carbon copy. So it has honestly made things very smooth. We just have to take the time up front to make sure we got the mapping right.
Got it. So once you went through that effort of making sure that the GL structures were, aligned, the actual transition within the tool was relatively straightforward.
Yeah, absolutely.
Got it. And I guess in terms of that transition, you said overnight. Was it literally overnight that you were able to transition it?
Yep. People didn't even necessarily know. I just kind of swapped the models out, and people were all of a sudden, they had the exact same access they did the day before, just in a different kind of roll-up structure, and life moved on without a hiccup. So it truly was a seamless transition.
Got it. And this is moving tech stacks, basically. You're consuming different information, that kind of thing. But once you got the mapping down, it was straightforward.
Yep. Flip of the switch.
Got it.
And obviously there was additional mapping on the back end, and some of the automation had to be pointed to different spots. But at the end of the day, it truly was a pretty simple exercise.
Got it. And what does that tech stack look like? I mean, you said you're using PeopleSoft today?
Yeah, so Optum utilizes PeopleSoft as their ERP system. On the legacy DaVita Medical Group side, we use Dynamics SL. We also leverage SnapLogic, which we will on the Optum Care side too, which is our ETL tool to push and pull data from. And on both sides, Essbase and Hyperion are utilized. The differences will be my team administers Essbase on the legacy DaVita Medical Group side. The United Health Group actually administers Essbase on the Optum, above the Optum Care side, so they're the ultimate owners of that. So that will be the transition there. But yeah.
Okay, got it. So I mean, this is kind of the elephant in the room, I guess. Obviously, right now we're in the middle of a pandemic. Everybody's working from home, and nobody's really seen the impact of this more than the healthcare industry and y'all. So how have you been leveraging Anaplan during this pandemic, and what have you been leveraging it for?
Yeah, so we've really leveraged Anaplan as a platform for reporting and consolidation of really the visits and the impact that COVID is having on fee-for-service specifically, because obviously with people being locked down, they're not going to be allowed to or feel comfortable necessarily getting out and going to see the doctors. So we wanted to get a sense for how that would impact our business and what the trends were showing. So we honestly stood up a model in about a week that shows the trends from right around when COVID started, so call it February 16th-ish, through today, of week over week fee-for-service visits across all of our CDOs, so that we're tracking that and we can kind of see the impact that COVID's having on the fee-for-service volume impact, which really just kind of gives the leadership insight into what are the next steps that we should take, what should we be expecting in the future, and allows them to make decisions based on that. So far, we're really just kind of tracking and reporting that versus doing too much modeling around it, but I think those will probably be the next steps. Got it.
So in terms of standing up this model, you said it was about a week, and I'm assuming that the different markets had, or the different CDOs had, Excel models that they might have had. I mean, what was that? What was that time save that you were looking at in terms of the being able to aggregate this large sum of data from how many different, I guess, places were you pulling data from?
It's about 20 different CDOs, so 20 different individual contacts. So the aggregation exercise to get everything put together, make sure everything was lining up, all the calculations were flowing as expected, et cetera, was about a 4-hour-a-week exercise. And we stood up the model in, again, honestly, a little bit less than a week. And now that the model stood up, the aggregation exercise is under 5 minutes. So people get, those involved in the aggregation exercise previously are getting about 4 hours a week back. And it takes my team 5 minutes to enter all that information into Anaplan, flows through all the models seamlessly, and they get an output that is executive ready. So
yeah, got it. And so you talked about that preliminary phase of this is how you're leveraging the tool and this is how you're leveraging the model, right? So I guess if you were giving carte blanche, what would be the next kind of step that you would expand it into?
I would say the next step I would expand it into, and this is really hypothetical, but would really be doing a bit more, forecasting and analysis based on the trends, what we're seeing in terms of new daily cases or COVID hitting, and really try to operationalize that and say, okay, based on these are the next steps that we can take to either try to mitigate, heavy impacts to the fee-for-service market. And, there are, plenty of ways that people could go about that, be it increase the ability of a company's telehealth services, capacity planning, things like that. I think that really taking a more operational look at things would probably be where I would take it personally. But that's what I think what I would do.
Yeah. So I mean, would you I guess when we're thinking about this, right, with this push towards telehealth, if you were to bring in, CPT level data or your CPT code data by provider or something like that, you're actually able to do analysis on a provider basis to see, what procedures they're performing and maybe operationalize or increase efficiencies between, what providers are offering more telehealth visits, something like that, or codifying your CPT codes for, or seeing what CPT codes align with in-person versus telehealth visits, something like that.
Yeah, I think that you kind of hit the nail on the head. You can really do some interesting modeling and capacity planning based on the coding and how doctors are positioned with their panels, and you could really operationalize a lot of the telehealth and say, based on X, Y, and Z codings, you will be in the office today versus a different provider's in the office tomorrow. Just things like that. They can really make some real impacts based on efficiency and the necessary social distancing, especially if there's a second spike coming. Just things like that.
Yeah, got it. What are some I guess what's some advice that you would give to an organization that's considering an Anaplan implementation?
I think the advice that I would say is probably the most integral would be gain alignment up front from everybody in your organization, all key stakeholders, and then even honestly down to the end users. I think it's really important to gain that alignment up front so that as you're going through an implementation, you're not having to backtrack or build out new user stories after that foundational period because you hadn't necessarily gone through the process of speaking through everything up front. And I really think that gaining that alignment and determining what can be standardized versus what still needs the flexibility of being a little bit customized to a certain market or a certain department, whatever the case may be. Really just gaining that alignment up front and saying, hey, here's what we're going to standardize, and we all agree on that, versus here are the things that we feel still need to be customized for a certain market region, what have you.
Got it. So what did your implementation look like when y'all were first going through it? Were you actually building? What did that look like?
Yeah, so that was really interesting, and it was when I actually very first started at DaVita Medical Group. It was my first couple of weeks, but we brought in a consulting group, and then probably 85% of the FP&A team was actually in the room with the consulting group, learning Anaplan, and then going through the user stories that we'd come up with and discussed with the consultants, and actually building them out ourselves, which was a fantastic way to A, learn Anaplan, but B, really get the buy-in and understand how the modeling worked, so that we could kind of be self-service, and any end users that got into the system, we were the ones that were able to answer the questions because we actually built the models ourselves in conjunction with the consultants. But yeah, and I felt that was a really, really valuable way of going about things. Just from an enablement perspective, it was really important to be involved in the actual builds, so that A, you understand the tool, B, you understand some of the mechanics behind the interface, and then C, you have that buy-in of really having done it with your own hands. I thought that was a really great way to go about things.
Yeah, and after we left, what was the next step? How did your center of excellence or the ownership of the tool change? Like when executives would come to you with a new request or that kind of thing, how did you tackle those kinds of things?
Interestingly enough, it sort of evolved. Once the tool was implemented and built out, all of us were kind of the quote experts at that time, but it was quickly determined that a team was needed that was going to be solely dedicated to enhancements and new builds for the tool, as it was brand new, it had just been stood up, and the possibilities were kind of endless. So after the tool was implemented and all of the markets were told, hey, this is what we're going to use to budget, and then down the line report and forecast, it was determined that a team was needed to really stand that up and be the administrators of that tool, which is how my team came to be, which is the finance innovation team. So, back then it was a couple of different individuals, but it really was born out of necessity, and we need some in-house experts that could really administer the tool, that were kind of tech savvy, but also knew the business side of things to a degree. So it really truly is a business-owned tool. We are part of the finance organization. We're not IT or anything like that. So it really was something that our CFO at the time, Jason, said, hey, we want this business-owned tool that a small group could administer and build enhancements whenever I want them, and kind of have that rapid deployment, so we can build out those reports in less than a week, or we could build a whole model in less than a week, and we don't have to go through the traditional bureaucracy of submitting a support ticket to IT, et cetera.
Got it. And I guess what is your interaction with IT look like? Do you go to them for specific data, that kind of thing? I guess what is that interaction look like?
Yeah. At Legacy DMG, we really didn't have to interact too much with the IT group, just because we already had access to all of the SQL tables that we needed, that things were actually getting booked to. So we could actually utilize the ETL tool SnapLogic to go and just grab the data. However, after transitioning to the Optum side of things, we have had to interact a little bit more with their data groups and their IT side to be able to get a data feed. Again, because we weren't fully integrated, it wasn't something that we could go and query their backend tables, obviously. That's a really large organization to just let a non-fully integrated entity start querying their raw data. So yeah, it's been really important for us to build those relationships and determine A, what the data sources are, B, what data is available, and C, kind of who the contact is, because Anaplan's a fantastic system, but it's only going to be as good as the data that you put into it. So it's kind of the idea of garbage in, garbage out. But again, it really is important to upfront determine the data sources and make sure that you're aware of them and who the contact is and how to get them. Otherwise, Anaplan can only be as good as the data that you're putting into it.
Got it. So I guess what I'm hearing is when you're going through an implementation, it's going to be really important to kind of plan ahead, right? To understand, crawl what are the immediate priorities? Is the data obtainable? That kind of thing, and then plan accordingly and build your architecture off of that, right?
Yeah, absolutely. It's very much a crawl, walk, run kind of progression. You really need to understand upfront, where is the data coming from? Is it accessible? Okay, how can you get over that hurdle if it is one? And then it's okay, how do you get into the model? Okay, how can you automate the entirety of the process so that nobody has to touch it and everybody's just consuming data and doing analysis based off of that. And
you mentioned earlier at the very beginning, right? We've got 500 some odd users in the tool today. How do you go about deploying a solution to that many users and having them adopt it?
The change management is always going to be a really tough hurdle to overcome. As whenever you make a wholesale change, like implementing a new system that people aren't necessarily familiar with, we found the best way to go about this was to message that it was coming, say, hey, here is what's going to happen. Here's the timeline. Here are the resources that you can have up front so that you can make yourself, or you can educate yourself on this. And then allow for that feedback loop. So allow people to express their concerns and, speak one-on-one with folks and say, I hear you. And I totally understand that the legacy process is obviously more familiar, but here is what you're getting in addition with this new process. And let me take 5 minutes to show you that it's not so scary. It truly is very similar to the old process. It's just in a slick new platform that you can access anywhere. So I think it really just has been very important for us to take the time to speak with our end users and say, here is the platform, let's go through it together, and I'm always here if you have any questions.
Got it. No, I think that makes perfect sense. I've been monitoring, seeing if we've got any questions coming through and tried to work some of them in there. Are there any other questions? I mean, we've got another minute or so in our session. Let me see if we've got any other questions. Doesn't seem like it. But yeah, no, thank you so much, Sean, for taking the time today to talk about your journey with Anaplan, how you guys have been leveraging it, and hopefully this has served as an informative mini session for everyone on the call that you can enjoy during your lunch break. If you have any questions, I believe we've got some contact information attached to the invite. Please feel free to reach out and ask us any questions.